Hi, this is Dr. Doreste with the Cranial Release Technique, back with another video. Today, another interview video, but this time I won't be interviewing Dr. D'Ambrosio. John will be asking me some questions, so it should be fun. And we'll see how this goes. So first of all, John, good morning.
Good morning.
Hope all is well down in Georgia. It's a hot summer down there.
It's going to be a warm one, but it comes with the territory.
Comes with the territory, that's it. Winters are nice and mild, I guess.
Very mild. I mean, we had some cold ones this past. Everybody had those sub-zeros, but otherwise, no complaints.
And you're in the mountains.
Pretty darn close, yeah.
And are you at elevation, or are you pretty much sea level where you are?
Probably sea level.
Sea level, okay. I don't recall the winters when we went to school in Marietta. I don't recall. I guess it was cool, but not like New York and New Jersey.
Definitely not.
Yeah.
I think most of us kind of blocked out that period of time because it was so intense.
Yes. And I think I do remember most people like me and you would probably walk around with maybe a light jacket, where the Florida people would be all in a parka.
Exactly.
And, all right. So fire away. Wherever you want to go with this, I'm open.
All right, great. And this is exciting for me because I get so many questions about cranial release. I get practitioners reaching out to me. How do I learn this? Tell me more about it. So it'd be great to kind of take those and hear them directly from the horse's mouth. So
okay. Let me go get the horse and I'll be right back.
So cranial release, how did you come up with cranial release? I mean, so many chiropractors are focused on the spine, which is fantastic.
Yes.
But you brought it up a notch.
Yeah, exactly. That's a good way to put it, because prior to getting into anything cranial, because I remember I started at Life Chiropractic College. I stayed there for 3 quarters, and then I had to move back to New York, and I went to New York Chiropractic College. And I remember towards the end, getting close to graduation, we had a cranial master that came in from some other technique. I don't recall what it was. And it was very interesting because he called for a volunteer. We probably had 200 or 300 people in the audience, students. He called for a volunteer. He checked. Her pelvis was misaligned. You could see one hip was higher than the other, was rotation. He put her on her side. He gave her a traditional chiropractic adjustment. He said, get up and walk around the auditorium and come back. And that's exactly what she did. And 1 minute later, when she returned, the pelvis had returned to its distorted, misaligned, subluxated position. And that's when he looked at us and said, it's not the pelvis, it's not the spine, it's the cranium. Now, back then, I didn't know what he was talking about. Then he looked at her and he said she had a sphenoid problem. He took his thumb, he put it in her mouth, he pushed, she screamed. And I said to myself, I think I'll stay away. If that's what cranial work is, I think I'll probably stay away from it. And I never really did anything with the cranium. Went into practice in Flushing, Queens, straight chiropractor, osseous adjuster. That's what I did. Around 97, 98, it came to me that I was missing something. And I guess what really dawned on me was people would come in with a subluxation pattern. I would do my technique. They would leave better, and they would come in on their next visit in that same subluxation pattern again. So I knew I was missing something, but I didn't know what I was missing. And then it reminded me of the story I just told you about the doctor back at school. I said, maybe it's in the cranium. And that started leading me into thinking about the cranium. And as you know, and as the students and everyone watching knows, there are many different cranial techniques. Balloons in the nose, thumbs in the mouth, and I'm not saying bad or good. I don't know anything about them. But that led me to start thinking. And then through another lecture I attended, a neurologist said something to the effect of, well, 80% of the brain, 80% of the nervous system is above C1. And that then really kicked me in to say, wait a minute, if my job here in this office is to reduce, relieve, remove nerve interference, I'm missing the main player, which is the brain inside the skull. So I need to address the cranium. That led me to other work, other studies, and 2005 is when I put this all together with the help of my friend Kurt Brenstrup, that you know, who's a very intelligent chiropractor in North Carolina. He's more the writer in the family. And that's when we launched Cranial Release Technique. After I had mastered this in my own practice, I had seen what it can do. And initially, I kind of experimented my technique, cranial release together. When my skill got better, when I believe I became a black belt, and then people would come in, I would do the cranial, I would do the checks to see where I needed to adjust. I would do the cranial release, I would recheck, and virtually everything was clear. Then my confidence got better, and that's when I realized, I think I'm just going to focus on this and see what happens. And that was 2004, 2003, 2000. So that was 20 years. So really, for the last 20 years, virtually the only thing I do with a patient, virtually, would be the cranial release. And even those people that come in with extremity issues, I got a shoulder problem, I got an elbow, a wrist, a knee, an ankle. When you do the cranial release first and go back and check, there's very little, if anything, to do after that. The nice thing is, of course, you can do everything and add the cranial release, or you could do like I did, which is, I just found, if I'm going to be with the patient for a minute or two anyway, why not just do what in my mind was the key, affecting the 80% and the rest of the 20%, the entire nervous system. And then through later studies, we learned through the dura mater, affecting the fascia, affecting the epineurum, of much deeper than what it appears to be. And the challenge always has been at any of these events that I would go to is they watch me do it. I take a minute and they say, that's it. You know, it's like, and that brings me, I mentioned yesterday, as you know, we had an air conditioning problem here. Central air went out. So I called the air conditioning company, and it's June, it's July 27 is today, 26?
26.
26. So it's the middle of the summer in New York. It's hot, it's humid, it's uncomfortable. 8 o'clock this morning, the air conditioning man comes. He asked me what's wrong. I said, well, the fans are blowing, but it's warm. He said, okay. He goes back to the truck. He gets a little box, puts it in his pocket, goes outside to the actual unit, the compressor, takes off the cover, looks, says, that's it. Takes the little piece out, takes the one out of his pocket, replaces it. He said, we're done. I said, you sure? I said, that's it? He said, that's it. I said, but that's going to make it blow cool. It's blowing now, but it's not blowing. He said, that's it. I said, okay, how much? $350. Now, I don't think he was there literally from the time I said good morning to the time I said goodbye. I don't think he was there for 5 minutes, if even. But it's blowing cold. So it's like the cranial release technique. You have a patient on the table. You do this thing that takes a minute. They say, that's it. Be like the air conditioning man. That's it.
Yeah.
Your legs are balanced. Your legs come in. If you're doing your HRV, if you're doing whatever other checks you're doing, you're going to see that the patient has improved, and that's it. Now, the difference is this piece outside is probably going to last for a year or 2 or 3. Unfortunately, when you and I finish with a patient and they go back into the real world, physical, chemical, emotional stress, we know that in a few days or a week or 2 weeks or whatever, they're going to come back and they're going to need another tune-up, so to speak. And that's just the nature of the beast if you want to function optimally. So,
right.
And one last thing I just want to say on that note, and the question always comes up, what about fees? How much should I charge for a cranial release? I don't know. You know, the answer is whatever I guess you think is fair in your neighborhood. You know, I remember training people in very rural communities that was $25, $30. This is years ago. Whereas friends of ours in Manhattan would charge $80 or $90. So depending on what generally a chiropractic visit costs, maybe a massage visit, maybe an acupuncture visit. But the point I want to make is I remember a very intelligent chiropractor telling me one time, and he was into practice management and he would train other chiropractors. And he said, you know, you have something very special. And yeah, it only takes you a minute, but remember, and you have to explain this, you have to get this in your head and make sure your patients understand it. And he said, it's not what you do to the patient, it's what you do for the patient.
Absolutely.
right? So if I knew how to fix air conditioners, I probably could have gone to the hardware store for $12.99 and bought this piece that he installed and done it myself. But I wouldn't know where to begin. So, just like people are trying to figure out their own health, and that's why I believe we have an answer with this thing called cranial release.
Definitely.
How it all came about. I launched it in 2004, so we're coming on, almost on 20 years now.
Which is great. And as you know, I've been there pretty much from the beginning, because I, just like you, I mean, my first exposure to cranial was while I was at Life. They had someone high up in the SOT from the headquarters come in and talk, and it was a whole day about cranial.
Right.
And it was amazing stuff. But similarly, it is extremely complex. There were so many different things to touch and points, and I thought it was great, but here I wasn't even in practice yet, and it was just too much for me. So I put it on the back burner. It's like, all right, this is something I always keep there. And then as I started practicing, just like you, there was that nagging thought and I started to investigate, and our paths had crossed at various events. And when you started this, it just made the most sense to me. And I just jumped on. And also the touch, I like your analogy with the air conditioning. The one I usually give with people is, you could go to a dentist, but say you have a cavity, and you can have someone with your mouth open and he's there banging around for 45 minutes. Or you could have someone who just goes in with the most perfect laser technology, goes in and out in 2 minutes. Which do you want? Right. If you want the longer procedure because you feel like you're not getting your money's worth, then you need to go to somebody who does that. Right. I'm the laser.
Right. No, I agree. And the old story was, when you go to the gas station, you fill up your tank and it used to be $20, but now it's $50 or whatever it is now. You say, geez, $50. It took me 3 minutes to fill up my tank. I mean, do you sit there and wait around to get your $50 worth, or do you put, you close up the tank and away you go? It is what it is. I could sit there and song and dance for 20 minutes, but it only takes a minute. So why not just do what you got to do? Go in, do what's best. And the other thing is, if you're going to sit in an office for 6 or 8 hours a day, if you want to help as many people, I mean, if I asked you, and I never did ask you, but I think your answer is the same as mine. If I asked you or other people, why'd you go to chiropractic school? Probably was to help people. I mean, that's right. That's at the end of the day. And if you could ask the same thing about a dentist, or you could ask the same thing about a medical doctor or a massage therapist or an acupuncturist, and the ones who say, well, I'm doing it because it's a good profession, I'm going to make a lot of money, they probably don't last, or they get burnt out, or they're very frustrated in practice. If you're just doing it for the money, it's fine, but it's probably not. I would rather go to the guy who wanted to go to school to help people. And that's
definitely.
That's me. I mean, that's the way I feel about it. And then what happened to me was, you start doing this and the word gets out. And again, as we just kind of discussed the other day, a lot of it is just confidence. I mean, the more you do this and the better you get, the more confident you are, the more you want to do it. And something happens. Some energy goes out. I don't know what you call it. I mean, I could be totally off base, but the only way I can explain it, something goes out and people say, you know what, I need to see this guy because he's doing something that I need that's very specific. And that's how it is,
I agree. So this is such a great technique, and times have changed. So when I first learned the technique, there was exposure because you would go to various seminars, and I know you had some days you do a talk one day, and then you'd have a booth and you would demonstrate on people. And that really blew a lot of chiropractors away, because I remember being there, and then at some points actually later on assisting with this, and people would go to other booths and there'd be other chiropractors or other modalities, and they would get all these treatments, and they'd come to us and we would see some of our indicators were absolutely off. Even though they just walked away from another booth, we would do what we did, and these people would just be like in shock about what sort of changes actually occurred, how long those changes lasted, because they would come back the next day. So that was in a time when there was a lot more FaceTime. People were hands-on. How are things done now? How do you present the material? How is it taught? How do people get to actually experience this?
Right. Well, it's all online at the moment. And there is and I always thought, give people the online platform. Let them go do the modules at home. Let them start using it, which, by the way, I'm pleasantly surprised. I really didn't know how it was going to work. But I'm pleasantly surprised that the people that follow up with me are doing fabulous with it. So maybe there's some people that don't need a live sort of hands-on event. I don't know. But the theory initially was to start, instead of me running all over and people having to travel into me and leave your office for 4 days and the money and the time and everything else, do the videos at home. And then sometime in the future, we're going to start doing some hands-on. I'm not ready to announce anything yet, but I think the time is coming where there's enough demand out there that we might have to start doing some live events where people can come in. I can be there, you could be there, some other instructors, we can critique them, watch them. And really, if you're coming in at this level, I'm not expecting you to leave here. If you're coming in here and you're doing it right, I want you to be here when you leave. I want you to just be a drop better on your contact point, on your analysis, on how your body is set up, the amount of force you're using, all the things that we talk about in this work. So I do see a point in the near future, where we may be doing some face-to-face live events. So keep an eye on the website, and I'll certainly make announcements when that's ready to be launched.
Okay, and that's, I think, is great, because I like both. I learned it hands-on before any of this was available. And then once you put the material out, I went through the course, and the course actually brought me up a level, because you kind of forget, you're away from it and you're just focusing on certain things like, oh, that step, I really got to focus on that step or this. So I think if it had been reversed, which it wasn't at that time, but actually taking the course online and then saying, okay, these are the questions I have, let me go to a live event and refine. I think that's a really great way to do it, as opposed to reverse. Because once you walk out, you have nothing to look at. You didn't record it. Let me go back to this point and watch it again. So I think that's a fantastic way to go.
Yeah, so it's true. If you leave the live event, you're so overwhelmed and you're doing it pretty good, but now you go back to your little practice, wherever that is in your part of the world, and you're kind of isolated from the whole CRT team other than a phone call. I mean, now with technology, you could call me and I could watch you through the video and make some analysis. But I'm almost wondering, I think, like you say, I think both steps are very important. Whether you do the video first, whether you did the live first. In your case, you did the live first. Most people now are doing the video first, and then those that want to come will come for a live event some point down the road. And I think that'll just take them to the next level of their skill, their understanding. And probably the key to all this is explaining this to a patient. I mean, education, to me, if they don't understand, then if you just lay a patient down and do the cranial release and say, okay, we're done for the day, and you don't explain what you did and why you did it, you don't have to give them a 5-hour lecture, but make them understand that there's a very specific reason why you just did what you did and what it's designed to do. That's a critical point of every visit in my experience.
Yeah, because I've noticed in cases in the past where I didn't adequately educate somebody, like, oh, that stretch felt good.
Yes.
And all they took it was I was stretching their neck out.
Yes.
And it couldn't be further from the truth. I mean, the way we're using the muscle specifically and going into what we're opening up, I mean, you don't need to go into that amount of detail, but you do need to explain a basic bird's eye view of this is why we're doing what we're doing. This is what's occurring.
Yes.
And if you miss that step, it's lost on them. They may still experience the results, like they can't not, but it's like, oh, that stretch really helped me. Can I do it at home? Can I,
Right. And unfortunately, you can't.
No, you can't. We found that out.
That's
quite often at events we ran.
Yes. Again, and that's, for those people that know what we're talking about and have taken the technique, again, it's a very gentle technique. It looks very simple. It is very simple. It's so specific. It's got to be done just right, that a lot of people at seminars would watch us do it and they would go home and try it on their wife or their husband or themselves. and really cause a lot of problems. So
Yes, they would actually
like
bring
anything
that
else,
person in the
it's
next
like me
day.
going out and trying to fix the air conditioner. I don't know which wire I'm playing with. I'm going to connect one to the other and short the whole thing out, and then I got a big problem. This was
Right,
a relatively easy fix in the middle of the summer for $325 to have central air. Everybody's going to go for that. So,
right, exactly. And
well, John,
just
the
to
only
kind
thing
of,
is we're coming up on the clock because I
oh,
know
wow,
you have
okay.
things to do. So, anything else? Any pressing questions on your end?
Not really. I mean, how do people learn about this? I think we may need to do a part two just because time flew so quickly, and
Right.
there are other questions that people have asked me that I want to make sure we cover. But how do people, if they've watched this video and that it just kind of intrigues them a little bit, how do they find out more?
All right, good. Well, the simple thing is go to the website, cranialrelease.com, hit all the buttons, order a free report, watch the videos, go to my YouTube channel. But there is a button on the website that's called Online Training Program. And if you click on that, that'll take you to another page and describe the online training program, the modules, how it works, why it works, and you can register right there and start today.
And I will say that if you do this, this is not, I'm going to sit down and I'm going to, start watching on a Friday afternoon and be done by Friday night. This is work. This is,
Yeah, well,
you are doing a very specific technique and you're learning so much through this. It is a real continuing education course, even though there's no C credits for it, but you're going to walk away with knowledge that you would not have gotten anywhere else. It's very intense.
that's true. And then if you take time, I mean, Kurt, I mentioned before, Kurt wrote the manual. So the manual is fabulous. It describes, because there are some people that are visual learners by video. There's others that like to read and think about it and reread. So you got that option. There's patient education material. There's how do you explain this to a patient? There's PowerPoint programs that you get with this. I wanted to put
Posters.
everything that you need to take this, study it, bring it into practice, and be successful with it. And of course, you always have the option to contact me. I'm sure you're open to people calling you,
Definitely.
asking you. So, I mean, we make it as easy as possible. So anything we can do to help you, I'm behind you because I don't know, there's maybe 1,000, 1,200 practitioners on the planet with 8 billion people. There's certainly enough heads to go around. So we want you to learn this. We want you to be successful at this. Cranialrelease.com is the website, and I hope to see you at the other sites and maybe at a live event down the road.
Sounds great. Thank you again for doing this and allowing me to have the mic and question you.
Great. Thank you, John. Thanks for
Right.
your time. Thank you, everybody out there. See you soon. Dr. Doreste saying adios. I'm going to hit the button, John.